Thank you all for being here. Good morning. Welcome to Gaudenzia's press conference for the launch of our fourth annual Frontline Report. I'm Dr. Patricia McKernan. I'm Chief Operating Officer here at Gaudenzia. Gaudenzia is one of the largest nonprofit providers in the United States. Gaudenzia offers evidence-based treatment and recovery services for substance use disorder and co-occurring conditions, serving thousands of individuals annually through our comprehensive continuum of care, regardless of comprehensive continuum of care, regardless of individual circumstances. Today, we'll share valuable insights and trends Gaudenzia observed over the 12-month period from July 1st, 2023 to June 30th, 2024, regarding substance use disorder and co-occurring conditions across our treatment continuum over Pennsylvania, Maryland, Delaware, and Washington, D.C. This conference is being hosted both in person and virtually, so we'd like to go over a few housekeeping issues. Please note that today's conference is being recorded and will be shared after the live event. For those attending in person, we'll open the floor to questions with prepared remarks after our prepared remarks. For our virtual attendees, please remain on mute and use the chat function during the question and answer session. We have monitors in the room who will facilitate your questions to our speakers. I'd like to now take a moment to thank all of you for joining us today. A strong, united community is here as our backbone of lasting change, and we can't tackle the ongoing overdose and addiction crisis alone. We will need continued partnership with stakeholders, advocates, community members, policymakers, partner agencies, and funders in an effort to improve access to care, reduce disparities, and meet complex health and social determinants of health needs of the individuals and families that we serve. I'd like to personally thank some of our special VIPs that are attending. Roberta Cancelier, who's the Deputy Director for Housing Services in the Office of Homeless Services here in the city of Philadelphia, as well as Michael Donovan, who's the Executive Director of the Philadelphia Alliance, who we are a provider agency. So thank you very much for all of you who are joining, but especially a couple of our special partners. I'd like to now welcome Dr. Deja Gilbert, Gaudenzia's President and CEO, to commence today's program. Dr. Gilbert is a licensed therapist and a distinguished executive with over 2 decades of experience in behavioral health care. She's responsible for our agency's oversight of 1,200 healthcare professionals across 120 programs located throughout Pennsylvania, Maryland, Delaware, and Washington, D.C. Dr. Gilbert?
Thank you, Dr. McKernan, for that introduction. I join Dr. McKernan in expressing gratitude to everyone attending today's conference. At Gaudenzia, we believe that knowledge is power and that real change happens when our efforts are informed by quality, actionable data. This belief led us to create the Frontline Report 4 years ago to share data on what we're observing at our licensed treatment programs across Pennsylvania, Delaware, Maryland, and Washington, D.C. The report provides state and county by county insights into demographics, information, diagnosis data, and key takeaways based on the trends we are witnessing in our programs. By sharing this information, we can collectively identify the needs of our communities. The stark reality is that we are losing too many children, siblings, parents, grandparents, friends, neighbors to substance use disorder, and too many barriers persist in accessing treatment and the resources needed for long-term recovery. By way of example, according to SAMHSA's National Survey on Drug Use and Health, over 48 million Americans had a substance use disorder in 2023, yet less than 1 in 4 actually received treatment. These barriers have dire consequences and reinforce the critical need for treatment and services. While provisional data from the CDC showed a promising 3% decrease in overdose deaths last year, an estimated 107,000 people died of an overdose in 2023. These numbers represent our families, our friends, and our neighbors. When we have visibility into what our communities are experiencing, we can better understand opportunities for improved approaches, identify gaps in care, and transform the way we offer treatment in the behavioral health industry. This transformation is essential to reuniting more families and saving more lives. So let's dive into some of the details and the overall highlights in our Frontline Report. During our 2024 fiscal year, Gaudenzia experienced a 5% increase in admissions, rising from 15,045 in fiscal year 2023 to 15,855 in fiscal year 2024. This growth underscores the rising demand for accessible, evidence-based treatment within our communities, and more importantly, the need to continue to eliminate the barriers that prevent individuals and families from accessing the services they need to recover their lives. At Gaudenzia, we pride ourselves on offering a robust, evidence-based continuum and low barrier programming that ensures a no wrong door approach to treatment, especially for our priority populations. We are encouraged that we have been able to further reduce barriers to care for vulnerable populations this past year, including through the licensing and certification of our SAMHSA-funded driving recovery for Pennsylvania Mobile Treatment Services, Pennsylvania's first licensed medication-assisted treatment mobile unit, and launch of our new SAMHSA-funded certified community behavioral health clinic in Baltimore's Park Heights neighborhood. However, we recognize more work must be done to reduce barriers and meet the needs of our communities. Consistent with last year's Frontline Report findings, opioid and alcohol use disorders remain the most prevalent diagnoses affecting individuals across our continuum of care. And we continue to observe high rates of polysubstance use, particularly within the use of stimulants. We strongly believe there is a continued and urgent need for low barrier access to medication-assisted treatment, or MAT, for those struggling with opioid and alcohol use disorders. We also believe in the need to implement evidence-based approaches tailored to address stimulant use disorder, for which MAT is not yet available. Also consistent with last year's findings is the high rate of co-occurring substance use and mental health diagnoses among individuals that we serve. Over 70% of our clients who completed a biopsychosocial assessment in our programs reported a history of mental health disorders, emphasizing the critical need to address both conditions simultaneously during treatment. This is particularly true for women, as we observed nearly 9 in 10 women in our women and children's programs reporting past mental health diagnoses. In terms of emerging trends, Gaudenzia witnessed a 3% increase in adults 55 and older seeking treatment, representing an 8% increase since our fiscal year 2022 report. Notably, nearly 1/3 of all admissions to our Maryland treatment programs were adults 55 and older, and nearly 1 in 10 were over the age of 65. While substance use disorder continues to predominantly impact younger adults, we cannot ignore rising overdose rates impacting older adults and the need for responsive treatment and Medicare reforms that expand coverage for the entire substance use disorder treatment continuum. As highlighted in our Frontline Report, access to evidence-based, life-saving care is essential for everyone. However, it remains out of reach for some of the most vulnerable populations, including pregnant and parenting women. Barriers such as the fear of losing custody when seeking help, difficulties in securing affordable and reliable childcare, and lack of transportation have prevented many women from seeking the treatment that they need. That's why Gaudenzia offers specialized programs tailored to meet the unique needs of these women. We understand the challenges mothers face and have been dedicated to providing the essential care and support they require for over 40 years. With the opioid crisis, increasing rates of alcohol use disorder, and rising stimulant use among pregnant women, and changes in federal and state laws regarding women's health, the need for these services is greater than ever. For these reasons, we continue to elevate and advocate for ongoing support and specialized treatment options for this population. As a longstanding provider and advocate for gender-responsive care for pregnant women and mothers with dependent children, we are proud to have had 577 adult female admissions and over 415 dependent children admissions into our programs. This includes nearly 100 pregnant women each seeking the support and services that will help them and their families thrive. National data illustrates the rising rates of overdose impacting pregnant and postpartum women. Thus, we are committed to expanding comprehensive access to treatment and medication assisted treatment for this priority population. In Pennsylvania alone, we welcomed 520 adult females into our women and children's programs, which made up a remarkable 90% of our admissions to these specialized gender responsive programs. Meanwhile, our Claymont Center for Pregnant and Parenting Women in Delaware, the state's only residential treatment facility for this vulnerable group, accounted for the remaining 10%. Of the women admitted in fiscal year 2024, stimulant use disorder is the most prevalent primary and secondary diagnosis reported at intake. This highlights a significant need to expand evidence-based, gender-responsive treatment modalities, specifically addressing stimulant use disorder within this population. I would like to now introduce Dr. Philip Moore, Gaudenzia's Corporate Medical Director. Dr. Moore, a leading expert in substance use disorder treatment and medical toxicology, will provide valuable insights from the clinical perspective, including our approaches to treatment. Dr. Moore?
Thank you, Dr. Gilbert. As previously mentioned, I am Philip Moore, a specialty physician and Gaudenzia's Corporate Medical Director. Together with a dedicated and skilled medical and behavioral health team, we ensure that Gaudenzia provides integrated care across our continuum for individuals with substance use disorder and co-occurring conditions. Our transformation in care focuses on evolving to meet the needs of the whole person. We emphasize a whole person approach, addressing not just the substance use disorder, but also the mental, physical, and social aspects of each individual's life. This comprehensive care model ensures we treat the whole person, not just the symptoms of the substance use disorder. As fentanyl and xylazine increasingly dominate the opioid supply, we are witnessing a growing need for enhanced medical support for individuals affected by these substances. The potency and dangerous effects of these drugs necessitate a more comprehensive approach to treatment. In response, we are proactively implementing initiatives designed to align our services with the ASAM 3.7 medically monitored level of care. This alignment will enable us to provide the specialized medical attention and support required to address the complex needs of our clients, ensuring they receive the highest quality of care during their recovery journey. The addition of this level of care will also better position us to meet the needs of older adults and pregnant women who also require more robust medical monitoring. Drawing from both our data and the national trends, we firmly believe there's an ongoing and urgent need for low barrier access to medication-assisted treatment, or MAT, for individuals battling opioid and alcohol use disorders. This need is especially critical for Black and Hispanic communities who continue to face significant disparities in overdose and access to these life-saving treatments. Our medication-assisted treatment, or MAT, combines FDA-approved medications combined with counseling and behavioral therapies, addressing trends and disparities in MAT utilization by increasing access and ensuring culturally responsive practices and reducing the stigma. Additionally, our harm reduction techniques and initiatives, including the distribution of drug testing strips, naloxone, community outreach, overdose prevention, education, and harm reduction services, minimizes the negative impacts of drug use, reducing overdose risks and spread of infectious diseases, ultimately saving lives. I'd now like to turn it back over to Dr. Gilbert.
Thank you, Dr. Moore. I want to underscore Dr. Moore's message on harm reduction by saying, by offering harm reduction and treatment services designed to meet individuals where they are, we will save lives so that when individuals are ready, they can build lives in recovery. It's vital that we improve access to care, reduce barriers to treatment and services, especially for vulnerable populations, such as women and women with children. We must also address racial disparities, social determinants of health, and meet the medically complex needs of those we serve. While Gaudenzia is known largely as a treatment provider, we have long understood that stable housing is an integral component to health and lasting recovery. We are proud to offer an array of emergency, transitional, and permanent supportive housing access across Pennsylvania and Maryland, where we served nearly 2,500 households last year alone. We must meet individuals where they are on their journey and in a personal way. By doing so, we can save lives, ensuring people receive the support that they need in time. Every life saved is a vital step towards recovery, as it provides the opportunity for individuals to embark on their path to healing. By offering support and intervention at critical moments, we can help more people overcome their struggles and move towards a healthier, more fulfilling life. We are making significant strides in our efforts, and we remain optimistic that the Frontline Report will continue to play a pivotal role in this endeavor. By providing comprehensive data and insights, the report serves as an invaluable resource for understanding the evolving landscape of substance use disorder and co-occurring conditions. It is our hope that this information will guide our collective actions and strategies, ultimately enhancing our ability to meet the needs of those we serve and fostering a more effective and compassionate approach to treatment and recovery. At this time, I'd like to invite back up Dr. McKernan and Dr. Moore so they may take your questions. And just a reminder for our virtual attendees, please remain on mute and use the chat function during the question and answer session. We have monitors in the room who will facilitate your questions to our speakers.
Also, I would like to acknowledge Christy Blaylock is our executive director for our Maryland programs. She is also on the call virtually. So if we have questions that are specific to Maryland, I know that she would love to be able to chime in. So we'll open it up for questions. Thank you. So the question is, how does Gaudenzia's program assist women and children programs in the needs that women and children present? So it's a great question, and women and children have been a priority for Gaudenzia for this year marks 45 years. Gaudenzia has always understood that women have to make very tough choices about whether they want to come into treatment or potentially lose custody of their children while they end up into treatment, when they go into treatment. And so when we opened our first program 45 years ago in Lancaster called Vantage, and hopefully some of our staff from Vantage are on the call today, we acknowledged that we had to be able to support the whole family. So in those programs, in our women and children's programs, we have staff that are dedicated as prevention specialists who attend to the needs of the kids who come in. There is childcare services provided, babysitting services while women are in treatment, but also that the prevention services offered to kids about age appropriate, that about how do we the challenges with drugs and alcohol, living a healthy lifestyle, healthy eating, all of the services that women as parents and or pregnant while they're with us are attended to. We linked really closely with our community providers in those programs in connecting women to prenatal care. It's an imperative that we have a good relationship with all of those providers. And so those are really specialized services cultivated over years, decades in some instances, relationships with places like Lancaster General or other providers of services that support women. That programming that goes on in women and children has to be gender responsive. We have specific parenting programs as well, curriculum that help women understand how to parent, especially when they might have, and we have had challenges with attachment and attunement. So there are a lot of clinical skills as well as the community partnerships that make those programs unique. What is especially unique is that we are really attempting to have the rest of our community attend to the needs of those women in a more formal way, as evidenced by our relationship in Delaware. We've had such tremendous support from the state of Delaware in opening the Claymont Center and understanding the need to braid other folks into that service. And so having DSAM as a significant partner, but having conversations with the Department of Health and Social Services, and understanding that we are preparing people for the next step of their life, getting ready for employment, getting ready for tenancy, becoming a tenant, and we have a supportive housing program there. So really thinking, as Dr. Gilbert said, about how do we attend to social determinants of health, because they are a driver of someone's recovery capital.
That's a great question. So one of the things about medication assisted treatment, or MAT, is there's increasing utilization, not only by Gaudenzia, but others, hospital systems, other physicians. There's expanded access, and it's showing that it's working. So people are living longer. So as people live longer, they're more likely to develop complex chronic medical conditions. And so we need to make sure that we're aligned to be able to treat those. Those conditions can be treated, can be caused not only by an aging population, but they can be complications from the substance use disorder, not only the opiates, but the other drugs that individuals might be using. There's also an increased prevalence of mental health, which was previously mentioned, and that also needs to be addressed. So, so Gaudenzia aligning and being able to treat not only the behavioral health needs, but the medical comorbidities is becoming especially important for not only us, but our community partners and the agencies that we work with.
Yes, thank you. So the question is, are there any new initiatives that Gaudenzia is planning on launching relative to the findings? I kind of want to capitalize on the earlier question too, and connecting the dots, right? So we are seeing, as we're looking very clearly at the women and children's data, we have, as I said, for 45 years been helping women, pregnant women, come into treatment. And that is a very complicated process. And I think over the years, we have acknowledged, and this data suggests the same, that women present with very complex needs. Dr. Moore has been advocating for a long time that we are treating women in our programs who probably need a higher level of care because of the medical complexity, just even of pregnancy alone, when you have a substance use disorder. So one of the big initiatives, and with our community partners and our funders that we have, and specifically in Pennsylvania with our partner with DDAP, the Department of Drug and Alcohol Programming, is expanded our licensure into what we call 3-7 medically monitored, which acknowledges that women, especially in our women and children programs, are coming in with more complex needs and need more attention, medically monitored attention, as Dr. Moore has pointed out, so that we can help them transition into their recovery process easier with the right complement of medical staff. It doesn't just end with the women and children's programs. We have looked at our other everywhere we offer a withdrawal management program, or commonly referred to as detox programs, we're expanding that too. You're seeing, as we said earlier, there's an increased use of stimulant use disorder, and they may not necessarily need to be into our withdrawal management programs, but they do need to be medically monitored. And so for us, I think acknowledging the predominance of co-occurring mental health disorders, that too suggests that we need to have an augmented medically monitored component in all of our programs to make sure that we're attending to those needs. That's a big question. I like how everyone wants me to repeat the multi-part question. So what are some of the big challenges that we face in implementing high quality services? Well, certainly, and I say this to all of our new staff and all of our existing staff, the work that we do is done through the individuals who work here. And so attracting, retaining, growing our existing staff is really an imperative. And that's all levels of staff, our direct professionals, our counselors, our nurses, our directors, our leadership. That is our biggest asset and certainly the biggest challenge, because without a motivated, dedicated workforce, the work that we do here wouldn't happen. So I think that that is always going to be a perpetual imperative for us to make sure that we're making the investments in our staff and in their continual growth. So we have a very robust training initiative for all of our staff in learning evidence-based practices. So I think that that's our biggest challenge. So concurrent with that, the biggest challenge is how do you pay for it? Right, is to have absolutely good partners and payers who acknowledge that this cost only goes up. Just like every other employer who might be listening on the press conference, is that these costs go up. Cost of labor, cost of benefits, those things go up. How do we keep competitive so that we can be at the cutting edge to make sure that we're saving more lives, not just today, but tomorrow? I just wanted to say thank you for everybody coming, everybody who participated online. If you have any other questions that maybe you didn't ask today, or you think of after you review the Frontline Report, it will be available on our website. You can reach out to Gaudenzia, and we will be glad to set up time to speak with you about any of the questions you may have. Or more importantly, if that you need care and you want to access care, please make sure that you contact us at our helpline or through our website. We're available 24/7. So thank you very much for being here today, and I appreciate everyone's attendance.